Do you need the light? It's very bright. Do you need it? Maybe just a little bit. You like that? Okay. All right, let me know if you're ready. You good? Good afternoon. Thank you for joining us on such a quick notice. I'm County Executive Laura Curran. I am joined by our Commissioner of Health, Dr. Lawrence Eisenstein, State Senator Todd Kaminsky, County Legislator Denise Ford, and Long Beach City Council President Anthony Aramo. I've also been in contact this morning with Kathleen Rice, Congresswoman Rice, as well as the City Manager of Long Beach, Robert Agostino. First of all, I want to thank Governor Cuomo for his quick support and swift action in providing additional resources as necessary. Already we're getting 30,000 bottles of water from the state, so thank you very much to the state for that. In the course of normal testing, and Nassau County Health Department does about 250,000 water tests every year. So just in the course of that normal testing, this morning, the Nassau County Department of Health received a distribution sample result collected from the City of Long Beach water system, which tested positive for E. coli. Based on the sampling result, the Nassau County Department of Health has ordered the City of Long Beach water system to issue a boil water alert in Long Beach. The City of Long Beach water system, in consultation with our County Department of Health, is currently investigating the source of the contamination. Long Beach has already raised the chlorine level. They raised it immediately and are currently flushing out the entire water system. The boil water alert will remain in effect until all of the samples results indicate that the water is free of bacteria and safe for consumption. We also have a call center set up, and it's running right now during this emergency. The number to call is 227-9570. That's 516-227-9570. Our emergency action plan has been activated, and a team of water, sanitarians, and engineers are in full force working to address this. Our Office of Emergency Management, and we have someone from OEM here with us now if you have questions, is in full response mode and is currently deploying trucks with over 21,000 bottles of water down to Long Beach. Nassau County is providing trailer and delivery services for the bottled water to 3 sites in the City of Long Beach. So through various methods, whether it's phone calls, going door to door, we're making sure that all the residents of Long Beach are made aware of the situation. And through the media, I'm happy to see you here to let everyone know. If you are in Long Beach, if you live there, if you're visiting Long Beach, only consume boiled or bottled water. I repeat, the only water that should be consumed in the City of Long Beach is boiled or bottled water, even if you're brushing your teeth. Baths are okay, but if you're washing your hands before cooking, we recommend boiled or bottled water. If you're washing a baby who tends to ingest water, boiled or bottled water for that as well. As county executive and our county government, the health and safety of our residents, in this case, those from Long Beach, is our absolute highest priority. I would like to turn it over now to Dr. Larry Eisenstein.
Thank you, County Executive Curran, and I want to thank the Governor's Office, the City of Long Beach for being a great partner, and County Executive Curran and our team here, our partners at OEM and various agencies who really have made an incredible quick response. We just got this result in the middle of the morning today, and here we are getting the word out. This is a precaution. As County Executive Curran said, we review thousands of test results a year. When we see E. coli specifically in the water supply, that is a trigger for us to take action to protect the health and well-being of the residents. I want to be very clear, we have not identified an ill resident yet. We do not have a case of E. coli, and I don't believe we will. Hopefully this is all being cautious, but certainly when we do have this test triggered, we do take actions. Regarding E. coli, it is a bacteria that when ingested can cause severe illness. So there's a reason we're taking these actions. We don't want people to get sick. Most cases of E. coli occur about 3 to 4 days after somebody consumes it. It can occur from 1 to 10 days, but most cases in the 3 to 4 day range. Symptoms may vary greatly. One person might have no symptoms at all, and another can get very, very, very sick. Some strains of E. coli, as you know, can cause severe illness and even death. So please don't take this lightly. But at the same time, we just want you to take common precautions. Bottled water is safe to drink. Water that is boiled for longer than a minute and then cooled is safe to use. And that is the recommendation for now. I'm very appreciative of the team at the health department and our inspectors who are going to be going all around and addressing actions that we want restaurants to take to make sure that they're serving food and drink safely. And so this is a concerted effort. It's been a great team response. A lot of work is ongoing. The health department will have a call center open to handle any questions from the public. And I'm just very appreciative of all of the efforts of government so far, and hopefully we will be successful in keeping our residents safe and free from illness.
Thank you very much. Senator?
Thank you. I'm State Senator Todd Kaminsky, and I live 2 blocks from where the sample was taken that has led us to this point. So I'm extremely grateful to County Executive Curran, to Governor Cuomo, and to the entire response team for their quick response. I have a 1-year-old son and a 4-year-old son, both of whom rely on the water in Long Beach, so this is incredibly important, and that's why this response is important, and it's important that every parent and every citizen and every visitor in Long Beach heed this warning loud and clear. I'm confident that all steps will be taken that are necessary in order to purify the water as soon as possible. If someone believes that there's something that needs to be pointed out, my office can certainly help shepherd you to the Department of Health or to the County Executive's office, and we at the state level will continue doing all we can until this issue is resolved. Thank you, County Executive Curran.
Thank you very much, Senator. Before I kick it over to Legislator Ford, I want to caution for the communities around Long Beach. For instance, Atlantic Beach, Lido, you don't have a problem. You have nothing to worry about. The water is absolutely safe. This is only for people who are serviced by the Long Beach water system. Legislator?
I too want to say I'm very grateful to our county executive and all our partners in government for their swift response to this issue. And for me, I know that we're doing this great outreach, but I urge each and every resident in the city of Long Beach to heed this warning and also to take into consideration the people that are visiting here and those that may be renters and those that may not be on the robocall system that the city of Long Beach has. I ask each and every single one of you to reach out to your neighbor to make sure that everyone on your block knows what's going on. As a matter of fact, I have somebody who just moved in next door to my house, and she has a cell phone. So I called her to let her know. She was not aware, would not have been made aware of this until I called her. So please, let's all be good neighbors. Let's all watch out for one another and just pray that this will be over in just a matter of a couple of days. But once again, thank you very much for your response. I really appreciate it.
Legislator, thank you.
Hi, I'm Council President Anthony Ramo from the City of Long Beach. I just want to let everyone know that we are notifying all our residents, as Legislator Ford has just said, through our robocall system. We've sent out emails. We also have a response app that we've been notifying residents through the app. And also, we are currently sending employees around the city to restaurants to give them a hard copy notification. And we're doing everything we can to make sure our most precious resource, our water, is safe for everyone to consume as soon as possible. I want to thank the County Executive, Laura Curran, and the Department of Health for working with our great team down in Long Beach to make sure we rectify this situation very soon. Thank you.
Thank you. Thank you very much. And I'm just so gratified that all levels of government, city, county, and state are working together very quickly to address this issue. Happy to take any questions you might have.
Do you have any indication how long the flushing and the treatment of the water will need to take place?
We're going to have our lab open basically almost around the clock to do sampling as quickly as we can to identify that the source has been eradicated, but we can't for sure say how long this is going to be in effect. Yeah. Sure. And it's funny, after I was done speaking, I said I should have mentioned some of the symptoms in between nothing and very severe. So the typical cases of E. coli, we see gastrointestinal symptoms, stomach cramping, nausea, vomiting, diarrhea. Some of the hallmarks of E. coli, it's typically not febrile. So very often when I speak about diseases, look for fever. This is not something that we often see. It can happen. And sometimes one of the things that we see with E. coli when people start to get really sick, the diarrhea can be a little bloody. It's after lunch, I'm sorry to bring that up, but you should know what to look for. And if anybody is worried about this, they're welcome to call. They should call their healthcare provider. But as I stated before, we have not identified a case, and this is being very precautious.
When was the sample collected, or when were you notified this morning of this sample?
I don't know the exact time, but we've had a couple of samples, and one triggered a repeat test, and that's not unusual for us, but it is not common to see an E. coli positive, and that result we got this morning, and here we are.
The city said that some water tested positive for coliforms, but not necessarily E. coli.
Yeah.
We had one positive E. coli test at a residence. Is there any indication that this could be isolated or more widespread?
Well, I don't think we have enough information at this point. I will say we do a lot of tests, and it's not entirely uncommon for a random coliform. That triggers us to look further. But when an E. coli comes out, that triggers the state code. It's the state health code that defines when we have an E. coli positive test, the actions that we need to take. And the actions that we need to take and the water district needs to take, and they've been wonderful in working with us through this today, are prescribed by law. It's pretty clear. And our water experts, a couple of them are here, are prepared for this. So an E. coli is something that we have to take this kind of action to. That's a bacteria that can be potentially very dangerous to the residents. So that's where we're at.
I know you don't specifically know in this case yet, but in general, how does E. coli get into the water supply? Is it failed treatment or?
I would prefer to turn that over to one of our engineers who's an expert in water. Angela, do you want to handle it? And this is pure speculation at this point. We don't have the answer to why there was an E. coli hit in the water supply. I'm going to introduce Angela Pettinelli, one of our senior engineers at the Department of Health.
Hello. So it's possible that there could be a bacteria in the water main, or it could be in their storage tank. That's why we're asking them to flush their hydrants, raise the chlorine residual, so that with enough chlorine residual in the system, that it'll kill any bacteria that's present. And we've enhanced requests for additional sampling, so we could get a full spectrum of what's out there.
And this sample came specifically for a place you routinely test as a private residence, or was it in the?
It was a private residence, yes.
You said that it was safe to bathe. Does that include showers, or do residents need to take further precautions for showers?
We're going to release to you a whole list of frequently asked questions that we're also going to have available at our call center. That's one of the questions. Residents who are not going to be consuming the water when they shower can use the tap water to shower, but for brushing teeth, which we know goes into your mouth, we are recommending bottled or boiled water. And with regards to hand washing, it's generally considered okay to wash your hands unless you're about to prepare food. If you're preparing food, we recommend you wash your hands with bottled or previously boiled water.
Is there concern, obviously, you have this big event this weekend in Long Beach, they're expecting 30,000 people in Long Beach. Is there an immediacy to get this word out to as many people as possible because of the fact that so many people are in the city?
Absolutely. That's why we're so happy that you're here to spread the word for the people who live there, for the people who are visiting. There is a big event happening. We want to make sure that everyone visiting Long Beach knows to bring their bottled water.
What about people who drank water this morning, yesterday? Should they be worried or just cautious?
Just cautious. We don't want people to worry, but we do want them to know if they get sick in the next few days, it's something to get checked out. There's no magic bullet at this point if you drank water. We also want people to throw out the ice cubes they might have made. And ice is a source that people sometimes forget about. And so even when our team communicates with the restaurants in Long Beach, we're going to want them to throw out any of the ice that was created, recently. And there are procedures for disinfecting an ice machine, but people who have ice cubes that they made yesterday or this morning in the house, we want them to throw it out and put, once this clears, put those ice makers through the dishwasher.
Laura, you mentioned something about
What did you mean by that?
For the water.
For the water. I'm not sure, but we can get you that.
It's to have an E. coli, to have a coliform, meaning we need to look at it more closely, is not terribly unusual. To have E. coli in the water, it's been a few years since the last time. So I've seen it before in my time to health departments. I don't know exactly how often, but it's not a monthly or weekly occurrence. It's years in between these events. And thankfully, we have a team trained and prepared to handle it. And this will be okay. We just want, especially with visitors coming, bottled drinks.
All right, I have the answer to the question of where the drop-offs are. There's one at Long Beach Regional Catholic School at New York Avenue and Grand Boulevard. The second is Kennedy Plaza, right at City Hall. The third is East School at Neptune and East Hudson.
How many residents altogether are impacted by this, and is your biggest concern just that people aren't going to be, not get the word in time?
It's everybody who is served by Long Beach Water System. How many residents are there? About 35,000 residents in the city of Long Beach. And yes, there is a concern that we want to make sure everybody knows, as Legislator Ford said, if you have an elderly neighbor or someone who may not be watching television or paying attention to the media or getting the phone call, knock on their door and make sure that they know.
What additional steps should restaurants and bars take? You have Friday, Saturday night, and should people still go out? I mean, you're talking boiled water for restaurants and bars. That's quite a trek.
I'm going to turn this over to Alana Greenblatt, one of our senior restaurant inspectors, who will be leading the team. And we already have inspectors down there, but this is a question that I think she's best fit to answer. Alana?
Hi, as was mentioned, ice is definitely of concern in our restaurants and our bars. They should cease using those machines. They can use bagged ice that does come from proper production facilities. It's, that they would purchase through an ice company. Obviously, they're not going to be using their water for food service. They should be following all the same precautions as a homeowner would follow regarding not using the tap water for rinsing produce or any other foods that might not be fully cooked. On the other hand, if it is food that might be cooked and it's coming to a full boil and coming to a full heat, that is fine. You're boiling pasta, that's going to be fine. Rinsing the pasta afterwards with cold tap water, that's a big no-no. Ice cream stores that use dipper wells for scooping ice cream should stop using them because, again, that's your tap water that's going right through.
What about glasses that have been previously washed?
So items that are properly washed and sanitized should be fine. The sanitizing cycle, either through manual dishwashing or running through a machine, should adequately take care of the problem. The key is to make sure that those items do air dry.
Is the water already at those locations if we were to go there now? At the Kennedy Plaza, is it there?
En route.
En route.
En route. Thank you very much.